Welcome to the last CBCLIPS of 2021. In this episode, I present you a little girl who has pancreatitis, some dilatation of her biliary tree, and is sent with a presumptive diagnosis of possibly having passed a gallstone. Let's review gallstones in children. There are three groups. One are patients who are obese. They have risk factors similar to adults with cholesterol stones. Two are patients who have hemolytic anemias and develop bilirubin stones. And three, patients who develop sludge and cholestasis early in life due to prematurity or other neonatal conditions. An important clinical principle is to suspect a choledochal cyst in any patient with any degree of biliary dilatation who does not fall into these categories as this girl does. And in fact, many of you did suspect that and recommend an MRCP. Here I show you her MRCP, which actually did not add much to our diagnosis and just showed some relatively mild dilatation of the common bile duct. I was quite secure in the diagnosis and I wanted to proceed with surgery, but the parents were hesitant and preferred to have her observed. We did observe her, and 4 months later, she came in with another episode of pancreatitis, and now you can see a significant fusiform dilatation of the common bile duct on ultrasound. Here you see her resection of the type 1 choledochal cyst by laparoscopy. I just finished by showing you her ultrasound again and another MRCP of a different patient that both show common hepatic duct dilatation. Very important to understand that by looking at the types of choledochal cyst, this is still a type 1. An important clinical principle is that dilatation of the common hepatic ducts does not make this a type 4. A type 4 is usually multiple intrahepatic or chain of lakes dilatations. You have to treat this as a type 1, and almost always the hepatic dilatation will resolve after resection of the choledochal cyst. Thank you. Merry Christmas to those who will be celebrating Christmas soon, and a Happy New Year to all of you.